Hi friends, today we are going to discuss about Alzheimer's disease. In this video, I'll be dealing about the definition of the Alzheimer's disease, incidence, pathophysiology, and the clinical features, diagnosis, and also the management briefly. Coming to the definition, Alzheimer's disease is never a sudden onset, it's always progressive, a neurodegenerative disorder where we can see which results in decline in the cognitive functions, which means thinking ability or the ability to take decision, thinking, this all will be declined in the cognitive functions and decline in the activities of daily life. The person who actually does his daily activities, they'll not be able to do that. And also behavioral disturbance. This collectively is said to be as Alzheimer's disease. Once again, it's progressive neurodegenerative disorder in which results in decline of the cognitive functions, activities of the daily living, and also behavioral disturbance. Coming to the incidence, incidence is mainly between 60 to 80 years. Alzheimer's disease most commonly occurs in old age people, but if the onset of Alzheimer's disease is below 60 years, then it is definitely autosomal dominant, which is mainly due to three main gene mutations, which is one among them is APP gene, which is located on chromosome 21, and the presenilin 1, which is present on chromosome 14, and presenilin 2, which is present on the chromosome 1. This is about the incidence. Now coming to the pathophysiology of the Alzheimer's disease, as I have said, it is nothing but neuronal loss, that is degenerative disease. The neuronal loss occurs in temporoparietal cortex and also in the frontal lobe. But first, the degeneration starts in the hippocampus area. As hippocampus area is for memory, the memory is lost, and the clinical features are according to the neuronal loss involved in the lobes. For example, if the neuronal loss is involved in the frontal lobe, the functions of the frontal lobe are lost. That's it. And in this, along with the neuronal loss, we can also see the inflammatory response. This inflammatory response is to two substances. That means it reacts to the two substances. One is senile plaques and the other one is neurofibrillary tangles, which means, coming to the first one, senile plaques. These senile plaques are nothing but the extracellular deposition of the insoluble material, nothing but the amyloid beta. This amyloid beta, comes from the enzymatic cleavage of APP, which means amyloid precursor protein. This amyloid precursor protein cleaves and gives rise to amyloid beta. This gets deposited, and which is nothing but a senile plaques. And coming to the other one, neurofibrillary tangles. This is nothing but the accumulation of tau proteins. These tau proteins are nothing but the main function of these tau proteins is, in the normal cell, it stabilizes the microtubules. But here the function is lost, and the tau proteins are get accumulated, which results in the neurofibrillary tangles. These senile plaques is extracellular because it is deposition, and the neurofibrillary tangles are intracellular because it is accumulation. These together constitutes the hallmarks of the Alzheimer's disease. These are the main important features to identify or in what we say for diagnosis of the Alzheimer's disease. Along with the neuronal loss, we can also see some other pathophysiological features, that is synaptic degeneration and the abnormal lysosomes and also the mitochondria. Now coming to the etiology. For this Alzheimer's disease, the exact etiology is not present, but there are said to be having three hypotheses regarding the form or development of Alzheimer's disease. One is cholinergic hypothesis, which means due to the reduced acetylcholine levels, the Alzheimer's is said to be occurred. And the other two hypotheses are amyloid hypothesis, that is accumulation of amyloid beta, and tau hypothesis, nothing but accumulation of tau proteins. Now, coming to the clinical features of Alzheimer's disease, the people of Alzheimer's disease have impairment of cognitive functions, behavioral functions, and also functional disturbances. And we can also see disturbances of memory, language, and also the visual skills. And one more important feature is anterograde amnesia. Anterograde amnesia means the people cannot learn new things. That means these people can retain the past things with full memory, but they cannot learn new things. And we can also see word finding difficulty. These word finding difficulty means, for example, if they want to express any sentence, they cannot find the right words. This is an important and initial manifestation of language disturbance, and ability to retain recently acquired information is lost. As I have said, anterograde amnesia. And we can also see nominal and comprehensive dysphasia. Nominal and comprehensive dysphasia means these persons cannot understand what the people are saying. That is comprehensive dysphasia. And they also they cannot identify or say the names. That is nominal dysphasia. And we can also see dyspraxia and agnosia, the other two most important features of Alzheimer's disease. Dyspraxia, they cannot carry out motor activities, but even though the motor functions are very intact. And agnosia is with the sensory functions. They cannot recognize or identify objects, but the sensory functions are intact. And we can also see decline in the activities of daily life, which gradually leads to disability to do the things and the dependence on others. Coming to the lab investigations, I'll just briefly say three main important investigations to rule out the Alzheimer's disease. First one is CSF, cerebrospinal fluid analysis. The protein levels are increased, but specifically tau proteins are increased, but the beta amyloid proteins are decreased. CT scan to exclude any intracranial pathology, and high resonance functional MRI is done to distinguish between the Alzheimer's disease and the normal aging. And the other factors or the causes responsible for the dementia are also to be ruled out. And we should also do blood tests and tests for syphilis, vitamin B12 deficiency tests, and the thyroid level tests, etc. And this is all about the Alzheimer's disease briefly. And if you are seeing this channel for the first time, please subscribe to my channel.